Hey there, welcome back to our channel. I am Dr. Ahmet Ergin. I am an internist and an endocrinologist. Today we are talking about something that affects nearly everyone at some point in their lives, which is low back pain. Did you know that low back pain can be classified into 3 categories based on how long it lasts? Well, no-brainer, acute, subacute, chronic low back pain can all have different causes and treatments, which we'll talk about. In fact, approximately 90% of patients have low back pain that doesn't have a specific cause. Bummer. But for those that do, spinal stenosis, disc herniation, compression fractures are the most common culprits. Now, those people we say don't have any cause typically are musculoskeletal, which is just some strains and some typical aches from posture, etc. Okay? But cancer and infection can also be common reasons, which can be important to remember. Also, visceral disease like organ diseases, kidney stones, abdominal aortic aneurysms could also be to blame. So, whether you're dealing with back pain yourself or just curious to learn because your mama got it or your husband is struggling with it, keep watching for some important insights. When it comes to dealing with low back pain, it is important to take a holistic approach. You heard me right, Dallas. Holistic MD channel, right? We have to be holistic. It's not just about looking for physical symptoms though, but you also have to consider psychosocial factors that could be contributing to the problem. Now, things like stress, anxiety, and other mental health issues can have a big impact on how our bodies feel. The same goes for maladaptive coping mechanisms like avoiding work or physical activity altogether just because you have a little back pain. Well, if you don't assess these factors, as doctors, I'm talking to myself, we might not get the full picture of what's going on. And if doctors are watching it, thanks for watching. I think that will help you too. That being said, a thorough physical examination is crucial. So, patients, let your doctors examine you when needed, okay? They need to rule out some important underlying disorders that could be causing the pain, like disc herniation or cauda equina syndrome. Sounds fancy, right? It's a serious problem that can leave you paraplegic. Let's talk about imaging. So, for non-specific low back pain, shall we? Right. Here's the deal. A lot of people ask for imaging. Routine imaging within the first 6 weeks of symptoms does not really make a difference in improving outcomes. It is true. You see, imaging abnormalities are pretty common in both people like without any symptoms or those who have non-specific low back pain. If you image someone, you will find something. So discovering these abnormalities might actually lead to unnecessary and expensive interventions. Yikes, nobody wants that, right? And then you get more complications. Now, but don't you worry, my friends. There are situations where imaging is totally necessary. You got to go for it if you suspect severe or progressive neurological issues like weakness, numbness, things like that going on in your legs or arms, etc. that is painful. Yeah, and then you have a back pain on top of that, definitely. That could be sometimes life-threatening. In those cases, plain radiograph can be helpful to check for fractures, which is the most important thing. You don't want to miss that. Sacroiliitis, which is an inflammation in your pelvis area, or cancer. So if the suspicion is still strong, an MRI also should be your go-to choice. And you can discuss that with your doctor. You're not going to order an MRI for yourself, but that's how it is. Now, listen up. If you've been dealing with that back pain for more than 6 weeks without any red flags, or if your symptoms persist, when I say red flags, they are the neurological symptoms, right? Or if your symptoms persist or worsen despite trying conservative treatments, or if you experience any neurological symptoms, like we discussed, the painful sensations or numbness or tingling or problem with urination, etc. Or you may be incontinent, you cannot hold your urine or stool, then you need to talk to your doctor immediately. Treatment. Let's talk about that. When it comes to treating low back pain, education is super important. You need to know what to expect. Help yourself sometimes to clear up some misinformation that you may have heard online or from some friend or something. You need to encourage yourself to do physical activity if it is possible. So if you can tolerate it, stay physically active, even if you have a back pain. It's all about staying active, avoiding bad rest. If your doctor is telling you go rest in the bed, change your doctor. So unless, like I said, you have neurological symptoms, you need a hospitalization, you need immediate imaging, something serious going on. I'm not talking about this. I'm just talking about you wake up one day, your back hurts. Don't just say, I'm calling day off, I'm going to stay in bed. Don't do that. Okay, let's not forget about checking for signs of depression, all right? Dealing with that appropriately is important. Who would say that depression can give back pain, right? But now, let's move on to the fun part. More treatments. So let's say you want treatment. You can't take it. We have got both non-drug and drug options to consider here. Of course, we like the non-drug stuff, right? Holistic stuff. But sometimes even surgery, if it isn't really needed, right? But for acute pain, we might recommend things like physical therapy, although people are like, I don't want to do that. But it's super important. You can use heat, you can use massage, or acupuncture. All of these will help, but it has to be done regularly. Not like once a month, every 6 months, not like that. Although, to be honest, there's not a lot of evidence because it's hard to do studies on those things. Now, on the other hand, spinal manipulation therapy shows some promise in reducing pain and improving function. Now, when it comes to chronic low back pain, there are a whole bunch of options. Well, there's actually exercise therapy for that. Manual massage, spinal mobilization, acupuncture, yoga, intensive. There's some interdisciplinary therapies at physical therapy centers, or even cognitive behavioral therapy. Pain is something very mental. That's why we talk about pain tolerance between people. One person is going to perceive the pain very different than the other person. If you're depressed, you're going to perceive the pain a lot more than the other person. You're in a rush, adrenaline rush, you're doing some sports, you may be cut, you may break a bone, you may not even realize because you're in a mental state of like something totally different, you may not even feel the pain. That happens a lot to soldiers. So that's why cognitive behavioral therapy, discovering what is exaggerating the pain, is very important. Now, I would say combining different approaches seems to work better in the long run. So when it comes to low back pain, don't expect miracles. Just try things out, stay consistent, and you'll be good. Now let's talk about imaging a little more. We don't always rush into that, like I said, unless we see some red flags or pain has been going on for more than 6 weeks with no improvement whatsoever. There are neurological symptoms. And if someone is not fit for surgery, imaging might not be as helpful because think about this. You find something, the person is in the hospice already, about to die. What do we need the imaging for, right? But let's talk about how to tackle that back pain a little more. There's this thing called NSAIDs, like your ibuprofen, your Advil. You heard of them. They're all over the place on TV. They advertise it. They're like candies. They're supposed to help with pain and disability caused by low back pain. But guess what? They are not the best option at all. They're just the first choice among pharmacological treatments. Can you believe that? That's the first choice. But fear not, my friend. There is something way better out there, and that's called Sugar MD Joint Support Supplement. Did you hear that? It's like a superhero for your back pain at sugarmds.com. Not only does it reduce your pain and disability, or it may, I will say, I never say it will for everyone, but it may help with some pain. It's a holistic approach, but also it may help reduce the amount of NSAIDs you use. Now, I would say goodbye to popping pills and say hello to some natural goodness. Now, if you're dealing with chronic low back pain on a daily basis, the story is pretty much the same. So regardless if you have the pain for 2 days or 10 weeks, they're still going to give you the same shit. Sorry, my language here. But we talked about that, right? There are other alternatives to explore. Like, for example, there are some non-benzodiazepine muscle relaxants, which are, if you know benzodiazepines, they are like very depending forming medications. And there's a medication called duloxetine. Again, I'm not a big medication guy, but sometimes these medications as a last resort may help. And duloxetine is one of them, or Cymbalta. Some of you will know with that name. If you are feeling a bit adventurous, you can actually even try some non-inhaled cannabinoids, although I cannot promise you the long-term efficacy on this one. Here's some juicy gossip for you too. Opioids aren't all that cracked up to be. In fact, in 2018 study showed that non-opioid medications were just as effective, if not better, in improving pain-related function for chronic back pain. Plus, they come with fewer side effects. So, don't take opioids if you can. You know what they say. A picture is worth 1,000 words. Well, in this case, an image might just be worth some answers. I mean, imaging. So if your pain sticks around for more than 6 weeks, despite trying other treatments, is that clear? And if you start experiencing neurological symptoms, it might be time to consider some imaging. So if you're putting that doctor off and your pain is sticking around 6 weeks, you start getting pain, numbness in your extremities, see that doctor, get your imaging. But they will be able to examine you, they'll get the imaging done, and hopefully nothing serious, but you don't want to miss something serious. I would finally suggest that if you can stay away from NSAIDs and explore some alternatives, that will be your best bet. If you're looking for a sidekick on this journey, SugarMD Joint Support Supplement that you can get at sugarmds.com will hopefully help you. Not a replacement to your medical management, but it's a good holistic approach. So, what about some surgical treatment? Well, most patients with low back pain don't need to go under the knife, thankfully, unless it's a serious case of like cord compression or that fancy sounding cauda equina syndrome, right? Some people with tumors get that. We might consider surgery for those with messed up nerves, a worsening spinal stenosis situation, or some stubborn chronic pain that is in the back, actually sometimes fixed by scalpels. Procedures like discectomy for herniated discs or decompressive laminectomy for spinal stenosis, they're on the menu. Your doctor, your orthopedician will decide on that. Let's talk about those trendy epidural shots, the glucocorticoid shots. Well, if you're diabetic, forget that, but they may be a popular choice for some pains and stuff, but honestly, they only give you a teeny tiny boost and only in the short term. Not that impressive, right? But hey, I would suggest use your holistic approaches. Try the SugarMD Joint Support Supplement. You will hopefully be happy at the end of the day. So, you can give it a shot to all these things before you try the injections, but sometimes trigger point injections are necessary if the pain is very stubborn. So trigger point injections can be actually okay because they are not necessarily steroids. They are like combination of some NSAIDs, etc., lidocaine, and at some point you will have relief, but it's generally short-lived. But if you're an NSAID junkie, like if you're popping Advils every day, you're just masking the problem. You're not fixing anything. So don't fall for them. That's it for today. If you want to learn more, sign up to my newsletter at sugarmds.com. I will see you in the next video.